Okay, it's Dr. Silva. I want to talk a little bit about what makes a good therapist. There's a separate video that I'm going to do on what you should look for in a therapist and what you can expect from a therapist, a good therapist, and the art of psychotherapy. That's going to be a whole playlist, so please look for that. I've also written a blog. In 2009, I wrote a blog, and so I'll put the link on here where you can click on that if you want to read it. But I'm going to do a video on it as well. This video today is more about the idea of qualifications. And I do want to say that because psychotherapy is an art, it's really hard to learn it. You can get your credential, and a person should have credentials, but it doesn't really guarantee that they're going to be a good therapist. And also a client-therapist fit. A perfectly good therapist may not be the best therapist for every client. The paradigm that they're using, the kind of therapy they like to employ, cognitive behavioral therapy, dialectical behavioral therapy, as opposed to other forms of therapy, psychoanalysis or client-centered therapy. There are a lot of different paradigms. That might not be a good fit. And also just the style, just the personality of the therapist might not be the best fit for every client. And so that's why it's difficult when patients ask me to refer them to therapists. Even if I know a lot of good therapists, it's almost impossible to predict how they'll get along, whether they'll be able to establish that rapport and that therapeutic relationship. And so it's not like looking for a board-certified endocrinologist with 20 years experience and knowing that if that person hasn't had a lot of lawsuits and isn't in trouble with their licensing agency, you're going to be in good hands. The bedside manner you don't know, and the rapport is still up in the air, but at least you can say this person is going to be qualified, they're going to be competent. In therapy, you really can't do that. But what I want to talk about in this video is the idea that who makes the best therapist, and if you want to be a therapist, what sort of qualifications should you seek? A lot of patients might think that the best therapist would be a psychiatrist because they're medical doctors. Nothing could be further from the truth. And this is because doctors are not trained in therapy, not one iota. The mental health treatment that we get is all clinical. It's psychopharmacology and diagnosing. It has nothing to do with psychotherapy. And then in residency, I happened to go to a residency program that had a very strong, there was a psychoanalytic piece, which is the Freudian psychoanalysis, but there was a more general psychotherapeutic bent. And so we had all 4 years, we had supervision, supervised therapy. We had to do therapy and all different kinds, and it was supervised. But not all residency programs necessarily emphasize psychotherapy that much. And so a doctor really gets very little, really. Even what I got was little. I happen to have an undergraduate degree in psychology. I always knew that I wanted to be a psychiatrist, and so I figured a little background in psychology would help, especially since I am interested in also the non-pharmacologic treatments. And I do psychotherapy with my patients. But most psychiatrists don't. Most psychiatrists are strictly psychopharmacologists. They want to see a lot of patients every day to make the most money that they can. A lot of doctors go into medicine because they want to make good money, they want a good lifestyle, and they're not particularly interested in doing therapy. It's time consuming, and again, it doesn't reimburse. Plus, there are plenty of other non-medical personnel that are doing it. So really, a psychiatrist is probably going to be the worst person to go to. Now, most of those people that would make terrible therapists don't do therapy, so you don't have to worry about it. The psychiatrists that are offering therapy are probably going to be a little bit better, but don't assume that just because someone went to school for 8 years and then did a residency, that because they have the most advanced degree, that they're going to be the best therapist. Nothing could be further from the truth. What you want is someone that is licensed, so you want a licensed professional counselor, and preferably someone with some experience whose treatment philosophy coincides with your own. So you want to interview a prospective therapist, and you want to get a feel for that person and kind of what their style is like, and ask them, what is their style? Are they very directive? Do they tend to give a lot of advice and a lot of suggestions and be very hands-on, or are they more laid back? And what is their treatment philosophy and what paradigm are they operating under? And then you have to have a few visits and see if the relationship is going in the direction that you want it to go in. But I did do a blog, and I will do a video on just some basic things that a decent, competent therapist should be offering you, like not falling asleep during your session and listening. This has happened in real life. People have fallen asleep and they don't listen. But you want an LPC, a licensed professional counselor. And if you are struggling with chemical dependency, you really should be going to group therapy for that, 12-step or non-12-step. But you might want to be seeing an LCDC, a licensed chemical dependency counselor. And if it's a person who's in recovery themselves, even better. But to become an LPC, to become a licensed therapist, and I guess every state is going to have different regulations, but it's two types of people. It's basically persons with psychology degrees and persons with social work degrees. So you have psychologists and you have social workers. This is what I'll say about the psychology degree. And keep in mind, I have an undergraduate degree, a Bachelor of Arts in Psychology. Psychology is one of those undergraduate degrees that does not, in and of itself, it's not an asset in the job market because it doesn't involve any specific skills. You can't do anything with it, basically. So if you get an undergraduate degree in psychology, as I did, then you should either be planning to become a psychologist, which means a master's or a PhD. You're going to keep studying in that field. And what do you do with those degrees? Basically research. You become an academician. You publish. So you run experiments. And that's really one of the main things you learn as an undergraduate is research design. You don't learn a lot of clinical. And what I did was I got a psychology degree as background just to have a college degree to help me get into medical school. It didn't apply at all when I studied psychiatry in medical school, but I knew that I was going to keep studying, and so I took an undergraduate degree that would otherwise, in and of itself, be useless. It's like an undergraduate degree in philosophy. Well, that's nice, but unless you plan to pursue a higher level degree in that field and then teach, you probably don't want to do it. Another reason to get an undergraduate degree in psychology would be if you're independently wealthy and you're a member of the leisure class and you are interested in psychology. So you don't need to work, you don't have to worry about getting a job, but psychology interests you. If you want to be a therapist, though, you really need to at least have a master's degree in psychology. It's different in every state, but you have to have a college degree in order to be a licensed professional counselor. So there's a certain amount of schooling that you have to have, and then you have to pass certain exams, and then you have to have clinical hours as well. So you have to do an internship. And so there's an LPCI, which is a licensed professional counselor intern, and those persons are supervised. And then you become a licensed professional counselor. You have to get a master's or a PhD if you want to see patients. Bachelor's degree in social work, psychology, whatever it is not going to be useful. So we're talking about seeing patients and seeing clients. You need to be at least master's level. To be a good therapist, you have to really have a love for it, to be really interested in it. And also there are certain qualities that it would be nice if you had. Maturity and wisdom and insight into yourself and equanimity and temperance, that if you have chemical dependency, you're in remission from that, and et cetera, as someone who's open-minded, who is not only intelligent, but unprejudiced, non-bigoted. You can't be a bigot and be a good therapist. And someone who's compassionate, who's empathic, who is a good judge of character and who reads people well, someone who is well-spoken. I mean, there are a lot of qualities. I'll go into that in another video, but if you're a patient looking for a good therapist, the most important thing is not whether they're a social worker, whether they're a psychologist, or even whether they're an MD. I don't want to prejudice you against psychiatrists who do therapy, but don't assume that they're going to be the best therapists. Look for somebody who does the kind of therapy that you're needing. Do a little research into that as well, and perhaps ask your other providers if they know of someone that they think would be a good fit for you. Thanks for listening.